8:11. Good morning and welcome back to the stream. So do you remember these two doctors here? You may recognize them. They're part of a group of physicians who spent time in Gaza providing medical help to those in need. And they're all with the Chicago area nonprofit MedGlobal. The group is fresh from their assignment, and one of the doctors is here with us this morning to talk live. Dr. John Kahler, thank you so much for being here.
You're welcome. Thank you.
Yeah, so you just got back on Saturday. Thank you for coming in. Because I can't imagine that type of long trip and what you guys endured over the last month. Can you just give us a little bit about what you experienced?
Sure. Thank you for hosting me. It's my pleasure and my duty. We went into Cairo on the 5th to make contact with the rest of the World Health Organization team that we were going in with. We crossed actually into Rafah, which is the Egyptian Gazan border on the south, on the 8th. We were deployed in 3 places. One was, at that time, Al Nasser Hospital in Khan Yunis was still open. So we had a senior team, and our surgeon and 2 emergency room doctor and an intensive care doctor went there. We opened up a primary health center, and that's where I was deployed. And we were seeing 600 to 700 patients a day there.
Wow. I was going to ask, what was a day like? What was the demand like on the staff there?
So there were 2 major demands, as you can imagine. In the hospital, the demand of firing, the barrage of firing was constant. The drones were incessant. There were peaks of intensive multi-victim trauma that happened both in the emergency room and then needing to go to the operating room. That was that level. And then at the primary health center and several of the sites we ran outside of that, there was complete chaos, as you can imagine. There were 600 to 700 patients a day. There was no heat. There was no sanitation. So it was a catastrophe, or it is a catastrophe. It's getting worse. Yeah.
We hear the statement answering the call. Mm-hmm. Can you talk about that decision to go?
Sure. MedGlobal, we come out of the Syrian conflict, and we've been operating since 2017. This is what we do, and this, of all things, has been probably the most significant humanitarian crisis since World War II, in the volume and the contextuality of it. And so we felt we've had a team in Gaza for 5 years. And our team came from the north, and progressively were displaced south. So we felt it was absolutely important for us to go to both see the team, help relieve the team wherever we could, bear witness to what was going on, as well as deliver services. I'm a pediatrician, so I was able to, 60% of the people in the Rafah are kids. Yeah. So I was able to do that, and we brought a surgeon, an anesthesiologist, an intensive care doctor, and an emergency room doctor.
Wow. I want to get to MedGlobal in just a moment.
Sure.
First, you mentioned, I didn't know that you were a pediatrician, specifically focused on children. Any moments that stood out to you? I can't imagine the emotional toll.
Well, the moments that stood out to me were the newborns. I was very, very surprised that all of them were sick. There were probably 80% of the kids I saw were under 1 year of age.
Wow.
The majority of those were under 6 months of age. 100% of them had bad diarrhea from the water and from the sanitation. There was a major outbreak of a virus called respiratory syncytial virus, which in the United States is basically a cold, and little kids get stuff and they're observed. But these kids go back to tents. They go back, if they don't have tents, they go to live on the streets. It's winter there. So there's no electricity. They're all under congested living arrangements. The heat is done by fires. And so it's actually at night without electricity and in this congested, crowded city, it's actually surreal to see these little pockets of flames going on.
Well, I can't imagine. So many of us can't imagine unless you're there. Lastly, we don't have very much time, less than 30 seconds, but I just wanted to touch on MedGlobal, your co-founder, just the work that you guys are doing and the support needed in that.
So we are in 9 countries. We're still in Syria, and our major work now, obviously, our focus now will be on Gaza, but the other countries don't go away. Sudan, Beirut, all of them, none of those go away. So our focus now will be on Gaza. We've sent another team in today, and we'll have teams go in every 2 to 3 weeks to serve.
All right, Dr. John Kahler, thank you so much for your time. Co-founder of MedGlobal, thank you for the work you did, and we appreciate you.
You're very welcome. Thank you for having us.